Hello, this is Dr. Emma Nichols with the information on the latest U.S. FDA approvals for the week of February 12th through the 16th, 2024. The podcast has been going since May 2023. It's just obviously, as you may know, a short summary of all the latest FDA approvals every Monday morning. And if you would like to tell anybody that you know in your own industry or others that might be interested in such a podcast, that would be really great. I'm just trying to grow the audience here. All right, thank you. So first up this week, the FDA has granted accelerated approval of Lifileucel, also called Amtagvi, for adult patients with unresectable metastatic melanoma previously treated with a PD-1 inhibitor, and if BRAF V600 mutation positive, a BRAF inhibitor with or without an MAK or a MEK inhibitor. Lifileucel, a tumor-derived autologous T-cell immunotherapy, is the first FDA-approved T-cell therapy for a solid tumor cancer. Lifileucel is manufactured using a proprietary process that collects and expands a patient's T cells from a portion of their tumor, which are then infused back into the patient. Melanoma, an aggressive skin cancer often linked to ultraviolet light exposure, accounts for about 1% of skin cancers, but a significant number of skin cancer deaths due to its potential to metastasize if not caught and treated early. The FDA's decision was based on outcomes from a global multi-center clinical study, including adults with unresectable or metastatic melanoma previously treated with systemic therapies. Lifileucel demonstrated a 31.5% objective response rate among 73 evaluated patients, including both complete and partial responses. Importantly, a significant proportion of responders maintained their response at 6, 9, and 12 months without disease progression or death. The phase 3 TILVANCE 301 trial is underway to confirm clinical benefit. The FDA granted the approval of Lifileucel to Iovance Biotherapeutics, Inc. Also this week, the FDA has approved Iloprost, also called Aurlumyn injection, for treating severe frostbite in adults to reduce the risk of finger or toe amputation. This marks the first ever FDA-approved treatment option for severe frostbite. Iloprost is a vasodilator that opens blood vessels and prevents blood clotting, offering a new tool for physicians to help prevent the life-changing amputation of frostbitten fingers or toes. Frostbite occurs in various stages, with severe frostbite involving frozen skin and underlying tissue, potentially leading to stopped blood flow and necessitating amputation. Iloprost's effectiveness in severe frostbite was primarily demonstrated in an open-label controlled trial that included 47 adults with severe frostbite. Iloprost was previously approved in 2004 for treating pulmonary arterial hypertension. The approval of Iloprost was granted to ICOS Sciences, Inc. Also this week, the FDA has accepted a new drug application from Lykos Therapeutics, previously known as MAPS, M-A-P-S, Public Benefit Corporation. And this is for MDMA-Assisted Therapy in treating post-traumatic stress disorder, PTSD. This therapy, combining MDMA use with psychotherapy, could become the first of its kind to receive federal approval, introducing a novel treatment and avenue for individuals suffering from severe mental health conditions. PTSD affects approximately 13 million Americans each year, with women and disadvantaged or marginalized groups more likely to be affected. Lykos Therapeutics application is supported by the results of 2 phase 3 clinical trials, MAP-1 and MAP-2, which demonstrated the treatment's efficacy and safety in patients with severe PTSD, noting no serious adverse events among those receiving MDMA. Standard treatment for PTSD is a trauma-focused talk therapy alone or in combination with the SSRIs sertraline or paroxetine. According to a manufacturer press release, while there have been advancements in the management of PTSD, there have been no new drug treatments approved by the FDA in over 20 years. The PDUFA target action date for this is August 11th, 2024. Also last week, the FDA approved NALIRIFOX as a first-line treatment for patients with metastatic pancreatic cancer. This is the first approval of a first-line treatment for pancreatic cancer in over 10 years. NALIRIFOX, which is NALIRIFOX, is a combination of chemotherapy consisting of liposomal irinotecan, also called Onivid, 5-fluorouracil, leucovorin, and oxaliplatin. It's intended for patients who have not received previous treatment for metastatic pancreatic cancer. Liposomal irinotecan, part of this combination, is already approved for use in combination with 5-FU leucovorin for patients with metastatic pancreatic cancer treated previously with gemcitabine. The FDA's approval was based on the positive survival benefit shown in the phase 3 NAPOLI-3 clinical trial, in which NALIRIFOX demonstrated an overall survival of 11.1 months compared to 9.2 months for the current standard of care treatment of gemcitabine plus nab-paclitaxel. NALIRIFOX differs from FOLFIRINOX, another combination chemotherapy for metastatic pancreatic cancer, by including liposomal irinotecan instead of irinotecan. Liposomal irinotecan is designed for longer retention in the body before breakdown, which may contribute to the efficacy and safety profile of NALIRIFOX. The approval was granted to Ipsen, the manufacturer of one of the key components of NALIRIFOX. Also last week, the FDA has approved Tepotinib, also called Tep-Metco, for the treatment of patients with non-small cell lung cancer with mesenchymal epithelial transition, or MET, exon 14 skipping alterations. This follows an accelerated approval granted in February 2021. Tepotinib targets and inhibits the MET gene alteration present in about 2 to 3% of patients with NSCLC. The full approval of Tepotinib was based on the results from the VISION phase 2 trial. In treatment-naive patients, the overall response rate was 57%, with 40% of respondents having a duration of response of 12 months or longer. Among previously treated patients, the ORR was 45%, with 36% having a duration of response of 12 months or longer. And the median overall survival was 20 months. The approval of Tepotinib for NSCLC with MET was granted to EMD Serono. Also last week, the FDA approved omalizumab, or Xolair injection, to reduce the severity of allergic reactions to one or more foods, making it the first FDA-approved medication to treat allergic reactions to multiple foods from accidental exposure. Specifically, the indication is for IgE-mediated food allergy in adult and pediatric patients aged 1 year of age and older, for the reduction of allergic reactions type 1, including anaphylaxis that may occur with accidental exposure to one or more foods. This is to be used in conjunction with food allergen avoidance. The approval came 2 months after the FDA accepted the company's supplemental biologics license application for this indication. Nearly 17 million people in the U.S. have IgE-mediated food allergies, with more than 40% of them being children, according to a manufacturer press release. The approval is based on the results of the phase 3 OUTMATCH trial, which showed that omalizumab significantly increased the amount of peanut, milk, egg, and cashew it took to cause an allergic reaction compared to placebo. Omalizumab was initially approved in the U.S. in 2003 and also carries indications for the treatment of asthma, chronic rhinosinusitis with nasal polyps, or chronic spontaneous urticaria. The approval was granted to Roche and Novartis. And now a word from the supporter of this podcast, Nascent Medical. Is your company in need of medical writing assistance? Visit nascentmc.com. That's nascentmc.com. Our native English-speaking MD and PhD level medical writers create fast turnaround needs assessments, medical news pieces, manuscripts, slide decks, ad board summaries, and much, much more, all for the price of a single freelancer, but with a much wider selection and with a background in the pretty much exact specialty that you need. Nascent Medical, we're here so that you never have to be without excellent medical writing help. Also last week, the FDA approved Budesonide Oral Suspension, also called Eohilia, for the treatment of eosinophilic esophagitis, EOE, in individuals 11 years of age or older. Budesonide oral suspension is the only FDA-approved oral therapy specifically for this patient population. EOE is characterized as a chronic immune-mediated disease that inflames the esophagus, leading to symptoms that can significantly impact quality of life, including painful swallowing and potential food impaction. The precise cause of EOE is not fully understood, but it's believed to be linked to various food and environmental allergens. If not properly managed, EOE can lead to complications such as esophageal narrowing. According to a manufacturer press release, the new formulation of budesonide, a corticosteroid available in several forms, has been developed to possess thixotropic properties, allowing it to flow more freely when shaken and return to a more viscous state upon swallowing. This feature helps ensure a consistent dose delivery directly to the esophagus, where it can effectively address the inflammatory condition and symptoms associated with the EOE, such as difficulty swallowing and choking. The approval is based on the results from 2 studies, each 12 weeks long, demonstrating efficacy in achieving histologic remission and significantly improving patient-reported dysphagia symptoms. According to the prescribing information, budesonide oral suspension has not been shown to be safe and effective for treatment of EOE for longer than 12 weeks. The approval was granted to Takeda. Also last week, the FDA approved the TriClip transcatheter edge-to-edge repair, or TEER system, manufactured by Abbott for the treatment of tricuspid regurgitation, TR, a condition characterized by the leakage of the tricuspid valve, which can cause significant strain on the heart and lead to other cardiovascular issues. This approval marks the TriClip as the first of its kind device designed specifically to offer a minimally invasive treatment option for a condition that has historically had limited therapeutic interventions. The TriClip system addresses TR through a minimally invasive procedure that clips together parts of the valve's leaflets to improve closure and blood flow direction, offering a significant improvement in quality of life for those who are not suitable candidates for surgery. The approval of TriClip was based on data from the Triluminate pivotal trial, which demonstrated the safety, efficacy, and quality of life benefits of the device. Notably, the trial reported that 90% of the patients treated with TriClip experienced marked improvement in the severity of their TR, with sustained improvement in their quality of life 1 year post-procedure. Again, that was granted to Abbott. Also last week, the FDA has cleared the investigational new drug, or IND, application for ACE-2016, an allogeneic gamma delta 2 T cell therapy for the treatment of solid tumors expressing EGFR, or epidermal growth factor receptor. The clearance will allow the initiation of a phase 1 first-in-human trial to evaluate the safety, tolerability, and pharmacodynamics of ACE-2016 in adults with locally advanced or metastatic EGFR-expressing solid tumors. This trial is expected to begin in the second half of 2024. ACE-2016, being developed by Ace-Podia, uses a proprietary antibody cell conjugation, ACC technology, which enables the conjugation of tumor-targeting antibodies to gamma delta 2 T cells, enhancing their ability to target and kill EGFR-expressing cancer cells. Also last week, the FDA granted priority review to Humacyte's Biologics License Application, BLA, for the Human Acellular Vessel, HAV, for use in urgent arterial repair following extremity vascular trauma, specifically when synthetic graft options are not suitable and autologous vein use is not feasible. The HAV technology comprises a universally implantable bioengineered human tissue that does not necessitate immune suppression and exhibits resistance to infection post-implantation. The BLA is backed by results of the V005 phase 2-3 clinical trial and real-world evidence from its use in treating wartime injuries in Ukraine under a humanitarian aid program. These findings demonstrated reduced rates of amputation and infection compared to traditional synthetic graft benchmarks. This expedited review process is scheduled to conclude by the PDUFA date of August 10th, 2024. All right, that's it this week. If you haven't already, go to learnamasstyle.com and check out my free course on ChatGPT-4 for medical writers and editors, and really anybody who wants to use ChatGPT-4. It's really short, 20 minutes long, teach you some little tricks and tips and things you can do to increase your workflow speed and hopefully helpful to you. Go to learnamasstyle.com. That's learnamasstyle.com. Thanks again, and I will talk to you next week. Take care.